My name's Pat McGinnis, and I'm the Executive Director of California Advocates for Nursing Home Reform. Joining us today are Blanca Castro, she's with the AARP of California, and Nina Weiler with AARP. Jessica Lehman, who's with Disability, Senior and Disability Action in San Francisco. Teresa Palmer, Dr. Teresa Palmer, who has a relative in a nursing home in San Francisco. And also Mike Dark, who's with CANHR, he's one of our staff attorneys, Tony Chicotel, staff attorney, Emil Petrinik, who is also our brilliant tech person, Mike Connors with CANHR, Prescott Cole with CANHR. And did I leave anybody out who's going to be talking today? We called this press conference because on April 9th, the industry, the healthcare industry, not just the nursing home industry, but the residential care assisted living industry, the hospital association, the medical association, wrote a request to the governor asking him to grant immunity for all acts, administrative, civil, criminal liability resulting from this crisis. One of the problems that we have with this is, one of the many problems we have with this is that what it would do basically is excuse elder abuse. We worked long and hard to get the elder abuse laws established in California. We also know that thus far, residents have absolutely no rights. The staffing requirements have been suspended. They're not allowed to have visitors. The long-term care ombudsman can't visit. Even the healthcare inspectors are not visiting these facilities. So we've suspended most of the rights for nursing home residents, and now the industry wants to suspend their right to sue for elder abuse, including elder financial abuse. So we have here today other organizations, including AARP, and if you guys would like to make a statement, please do.
Thank you very much, Pat. This is Blanca Castro. I'm the Advocacy Director for AARP California. We represent approximately 3.3 million Californians in this state, and our position is pretty clear. Waiving the legally required staff to resident ratio in any nursing home at this time is completely unsatisfactory. This opens the door wide for residents to be unprotected or abused. Several members of our own team have loved ones in institutional settings, and we know what a stressful time this is for residents and for the workers, with increased demands on them without proper safety equipment available. So while the current crisis has clearly exacerbated the problem, hiring and retaining qualified workers is not a new problem for nursing home owners. The proposed action puts the safety and health of both residents and workers further at risk. If owners want to mitigate the current staffing problems, they can increase pay for workers, they can do a full court press to get proper personal protective equipment for their workers, and they should continue to recruit for vacancies. The state should require that any facility that's not able to meet its staffing requirements at the minimum are unable to meet the very basic needs of residents, that they immediately report this. And that's all facilities, regardless of their size, so that the state can step up and respond to that. Thank you very much for being here.
Thank you, Blanca. I want to point out that the request for immunity is not just about nursing homes, for liability for nursing homes. It includes assisted living facilities. It includes adult residential facilities where the majority, overwhelming majority of the residents of those facilities are people with disabilities. And that's one of the reasons why we've asked Jessica Lehman to join us too, because she is the head of the Senior and Disability Action Group in San Francisco. Jessica?
Thank you very much. Sorry to be a little bit late, but glad to be here to talk about this really challenging, troubling topic. As Pat said, my name is Jessica Lehman. I'm the Executive Director of Senior and Disability Action. We are based in San Francisco, although we do some statewide work as well. We are really concerned about the the outbreak of illness and death we're seeing in nursing homes, and really disturbed also that it's not particularly surprising, and that it should have been paid attention to much earlier. That nursing homes are often places that are ignored, and where the people in them are ignored, where people are isolated, where sometimes people are there because we don't have the right support set up for people to be at home or for people to be active in the community. That families often don't have great options. And sometimes people get good care, sometimes people don't. You know, as was just pointed out, they are typically understaffed. You know, it's very disturbing that some of the cases we've heard of where there has been a COVID-19 outbreak at a nursing home has been because staff are forced to work multiple jobs, and they work at multiple facilities, and then they are at risk themselves at more risk of contracting the virus and of spreading it. And there was a campaign from hotel and restaurant workers a couple years ago in San Francisco with the slogan, "No one should have to work more than one job." It just doesn't make sense. It's not sustainable for families and for communities, and it has an impact on seniors and people with disabilities. So we've been talking a lot in the disability community about care rationing, right? Of the fears that if hospitals don't have enough beds and ventilators, that they will decide who gets treated. And we heard about this in Italy and Spain about if you were too old, that you would just not get treated, that they figured your life wasn't as valuable because you didn't have as many years left. And there's huge concerns that it's being talked about in a lot of different ways in the US, but it's really about who has the most years left, who is assumed to have the most, the greatest likelihood of success, of treatment, all of these things that devalue and deprioritize seniors and people with disabilities. And I think what we're seeing in not only nursing homes, but in all sorts of group homes, board and cares, all kinds of facilities for disabled people, often particularly people with intellectual and developmental disabilities, as well as nursing homes, is another form of care rationing. That we haven't been paying attention to people in nursing homes because I think we are subconsciously saying that their lives are not as valuable. That they haven't been the first in line for being tested and for being treated. And we have to recognize that for what it is, that it's really a horrible symptom of ableism and ageism that we often like to pretend don't exist and that very clearly do. So I really hope we can hold all of our congregate settings and the people who run them responsible for making sure that people get the best treatment possible in general and specifically in this moment with the coronavirus, and that we hold ourselves responsible as a society to address our very deep-seated ableism and ageism and to fight back and to say that the lives of seniors and disabled people, and let's be honest, particularly poor people and people of color who are the least likely to have options and to have resources, that these people matter, that we deserve to be paid attention to, that we deserve to live. Thank you.
Thank you, Jessica. I want to turn it over to Dr. Teresa Palmer, who has a mother in a nursing home in San Francisco that is actually accepting positive COVID-19 patients from acute care hospitals. Dr. Palmer?
Yeah, I'm a daughter of a nursing home patient and also a retired geriatrician who has spent a lot of time in nursing homes. And I find this proposed law quite terrifying. And basically, the nursing homes that are the worst affected and the care homes that are most affected are the ones that are run for profit and whose staff is lean as possible because payroll is the biggest expense. And so staff and patients are pretty much in the same boat where they will be exploited and they will be ignored if you can get away with it. And this is an industry-sponsored law that is asking to do even less in a industry that already has very weak regulations and has a lot of death from COVID. And in California, in fact, we are not in a crisis. We're doing quite well in terms of the COVID crisis, and a secondary wave is likely to come from like nursing homes if the care is not adequate. And so there's multiple reasons why you shouldn't offer even less protections to both patients and to staff, which will occur if this kind of law comes into place.
Thank you, Dr. Palmer. I think the biggest thing that we need to focus on is the fact that if in fact the governor issues this directive and this order, what they're saying to all healthcare providers, anything goes, and you won't be held responsible. There'll be no administrative, there'll be no civil, there'll be no criminal liability for anything you do. And that's a very, very dangerous position to take. Mike Dark, Tony, do you have anything to ask Prescott to add?
Yeah, the proposed immunity would permit nursing homes and other facilities to take in COVID patients for profit, even if they are not able to keep the contagion from spreading to other residents. That is, it would immunize even dangerous and reckless conduct. The governor must reject this proposal.
Anybody else?
Also, yes, also it would eliminate any incentive to do any extra measures. They'll be given immunity, and basically they can walk away from the current responsibility, and again, not add anything more in the way of adding more resources to their already failing facilities.
And they've already waived the staffing requirements. They've waived most of the residents' rights. They've waived the sideline, the ombudsman, the inspectors. They don't have, they've waived all of the annual inspections or even increased inspections for those facilities who have been failing for years. I don't know if the consumer attorneys of California are going to make a statement, but they have joined us in this effort too. So we really are calling on the governor, don't sign this, don't issue this, because what you're doing is you are allowing elder abuse to occur in all of these facilities. And now I'll open it up to questions. Anybody?
Hi, this is Scott Acree. Can I say something before we get into questions?
Absolutely.
So my father, many of you know, my father passed away from COVID-19. He was a patient at Gateway. And the idea that, and we're a very, very practical family. We know that not all nursing homes are bad. They cannot all be painted by the same brush. However, the idea that bad actors will be able to act with impunity, does this open up the door for euthanasia if they are suddenly overrun with patients? What's being requested is incredibly broad, and there should be no excuse for anyone to violate the law and not take ordinary precautions, even in an extraordinary situation. The idea that the county health department for the county where my father was at has made a statement publicly to say that they are having a difficult time getting answers to questions, and they're asking the state to step in because they have no ability to provide oversight for this nursing home. It's extraordinary. So I think the idea of giving someone a blank check to do whatever they want to do is antithetical to just who we are. And so I'm adamantly against it, and this should not be allowed to happen. That's all I wanted to say, Pat. Thank you.
Thank you, Mr. Acree. I didn't recognize you at first. I thought you were a reporter, and then I realized I'd asked Vedante to ask you to participate. I really appreciate it.
Can I say one thing?
Yeah, sure. Go ahead.
My mother is at the Jewish home in San Francisco. She's 102. This is removing protections from the people who are most likely to die. And it will lead to a second wave.
Mm-hmm. And I think one of the things we point out in Mr. Acrie's situation, I believe the Alameda County District Attorney's Office has opened a criminal investigation. And if we have a proclamation like this from the governor, it would end that. There wouldn't be any kind. And the Gateway was an historically underperforming facility, has been for years. Understaffed, undertrained, not enough PPE. They knew that. They were not prepared. And so it would, in a case like that, it's exactly what it would do. Any other questions?
So just a quick reminder, you are all automatically muted upon entry. So if you want to speak, just press the space bar to speak.
Okay. Tony, want to add anything?
Well, if there's no questions at this time, I mean, we sadly weren't shocked that this letter went out, that the governor is considering this proposal, but we are aghast at the breadth of it. I mean, this would pretty much turn a blind eye to all sorts of misconduct, short of intentional misconduct. So as Mike mentioned, recklessness and dangerous decision-making would all be immunized. We've already lost the eyes and the ears in these facilities with family members being excluded, with ombudsman programs not going in, with surveyors not going in. And now the providers are asking us to, even though we no longer have eyes and ears there, to turn away from any other misconduct, including elder abuse and neglect. This is just unconscionable.
So we're hoping that this could act as a preemptive strike to tell the governor, don't do this. Don't let these facilities and healthcare providers throughout the state of California and assisted living facilities get away with elder abuse. Because this is a very, very dangerous path. Too many people are already dying from the poor care that they've gotten. Too many facilities were already understaffed before the coronavirus hit. Too many facilities simply weren't able to care for people in the first place, minus the coronavirus. And now what we're going to do is grant them blanket immunity from all and every act of negligence and reckless behavior. And that's pretty much it, unless anybody has any other questions or they want to add anything.
Pat, this is Blanca with AARP. Oh, who has a question? Go ahead.
Hi, my name is Anna. I'm a reporter with Kaiser Health News. I have two questions. The first question is, given that nursing assistants and other staff are being put on quarantine for potential exposure or like actual positive results of COVID, what do you say to nursing homes who say we have no choice but to run this understaffed? There's no one who's available to work.
Tony, oh, go ahead.
Should I answer that?
Who?
I think that staffing is already a problem. If it's unsafe, you need to report it. You need to be transparent about it. And I think we have more of a problem with people not testing and allowing asymptomatic staff to infect the patients. If patients have to be moved to another facility for their safety, it's better than dying.
Well, and I would answer that in saying that the governor has already said that for those facilities that are understaffed, they're going to send in strike forces into those facilities. Well, then do it. It's not happening. We don't see it happening.
But be transparent about it.
Absolutely. And the problem with this is that the Department of Public Health has been poorly over regulating nursing homes in the first place. They haven't done their job. And so this is a natural disaster. It was an expected disaster waiting to happen, because if you look at Gateway, for example, that was terribly understaffed in the first place. I would say 50% of the facilities in California did not meet the required staffing hours per patient day, even before this happened. So if we learn anything from it, it's let's pump up staffing, let's start paying staff enough so that they don't have to have two jobs in order to make a living wage. Those are some of the responses to that. But in terms of facilities that are currently understaffed, they were supposed to be prepared for this. The department was supposed to provide them with the support necessary to be able to provide the staff necessary to care for people. And yet they're still telling facilities, you have to take COVID-19 people from acute care hospitals which is really unconscionable and reckless. And now to say, well, we're going to grant immunity for any civil or criminal action is, again, unconscionable.
Nursing homes are free to not take patients if they can't safely do it, but they need to say that.
Yeah, we've been saying, just say no.
I also need to point out that the first time that I found out that Gateway was understaffed was when they told me that they were testing my father. Okay, I got no advance notice that they were understaffed, or even any notification that they had a COVID-19 outbreak there. And it was only by me asking questions after my father had already contracted it that I found out that they were dramatically understaffed. That some staff members weren't coming in because they were in fear because of a lack of PPE and a lack of testing there. And that was the only way that I found out. And subsequent to that, I found out that Gateway was actually pressuring people that were symptomatic, and some of which had been diagnosed, to come to work anyway and just wear a mask that they didn't even have. So this is not something that all of a sudden just occurred, and it's not an excuse to give everybody a broom to sweep away history. This is something that's been going on historically, and unfortunately it's affecting one of, if not the most vulnerable portion of our population, and we need to do something about this. We can't allow this to happen.
Yes, and Anna, this is overly broad, and when they talk about immunity for criminal conduct is intentional conduct. So if somebody intentionally commits a criminal act, it would be immune.
Any other questions or comments?
This is sort of like not right on topic, but would anyone on the call care to discuss their theories about why they think even 4- and 5-star rated facilities are having major outbreaks? Do you feel like the presence of these outbreaks at like highly rated facilities suggests that even well-run places are immune, or do you feel like it suggests that, like maybe these ratings don't mean that much?
It's because of the absence of testing of asymptomatic people. If you can't tell who's infected, you don't get early warning. And also, even the best facilities run as lean as they can on staffing. Like at the Jewish home in San Francisco, where my mother is, there's supposed to be 3 CNAs on the PM shift. Routinely, there are only 2.
Well, even if you do everything right, and if it's not intentional, it's not reckless, it doesn't come under the auspices of elder abuse. Our goal is not to punish those facilities who have tried to do their best. Our goal is to take a look at what the elder abuse law is supposed to cover. The idea that we're going to grant immunity for all administrative, criminal, and civil actions to all healthcare providers is absurd. We certainly don't want to punish the facilities who've tried to do their best. When you have staff members going from one facility to another, even when everybody else in the facility is isolating in place, we know where it's coming from. So there are other issues here. It's not just, and it's not, we want to punish all facilities who have a COVID outbreak. That's not what this is about. Jessica, you had your hand up.
Yeah, I was talking to a physician who works at some nursing homes in Northern California, and there's one chain of nursing homes that has very high ratings. It's a beautiful nursing home. It's very expensive, and they have been doing remodeling. Often, this physician was talking about remodeling that just makes it look more up to date, but doesn't seem necessary at all. And they pay their people terribly. And so I think it's really important that the ratings don't always show what's happening under the surface. And I think it's a sign of the problem in our private system, that how do we have all of these facilities that are for profit, where they're interested in the ratings so that they can bring in more money. They're primary incentive is not giving the best care. That doesn't mean that there aren't a lot of good folks that want to provide the best care, but if we have our system set up where that is not of the utmost importance, and now we're talking about increasing that by giving immunity, then we really have a problem.
Hello, my name is Brian. I'm a reporter with the Sacramento Bee. I have a couple of questions. The first one I think is fairly focused, and the other one's a little bit more broad. Let me ask the focused one first. Governor Newsom on late Friday night finally released the places that have had COVID-19 outbreaks, and it was great. We finally were able to see where they were, even though local counties hadn't been telling us. But a couple of counties in particular, Fresno and Kern, have refused so far to play ball with that. And I was wondering if you folks have any thoughts on that one, and my next question will be after you guys answer.
This is Blanca with AARP. I would just, first of all, say that, yes, the reporting and the transparency that was released on Friday is the first step. Let me just back up. The governor did issue a directive on stay at home, save lives, and started with the 65 and older. He's taken steps forward in trying to protect the most vulnerable and the elderly in all assisted facilities. What we're saying about this particular request is it is not the right time. In fact, it goes against everything that has happened to date. And for counties like the ones that you mentioned, but any county, what are they trying to hide? And why aren't they sharing this information? So we do expect that all facilities, including the small facilities, be part of that reporting, so that somebody and the state can react. We have the health corps where they're trying to recruit more healthcare workers, and we have the ability right now to address these hotspots that are happening across the state, that are happening across all our nursing and assisted living facilities. So all we're asking for is don't issue this executive order, keep the pressure on and transparency, and let's help the facilities to be able to staff up and pay decent wages so that people can live.
I want to respond to that too in terms of releasing the names of facilities. That's only a start. People want to know who has it. Are the residents, or how many residents, how many staff people in those facilities? It's taken weeks. We've been asking for the last 4 weeks for the Department of Public Health to publish a list of facilities. We've been asking the Centers for Medicare and Medicaid Services to publish a list of facilities. Not just if you have one or more. LA County was the only county that did that in the beginning. And then you looked at, and they published both assisted living, board and care facilities, adult residential care, they published it all. But what this list does, it's a list of nursing homes that has one or more COVID-19 positive persons. That's really not enough for people. They want to know who has it. Do residents have it? Do the staff have it? How many assisted living facilities and which ones? That's still to come, and it hasn't happened yet. And as far as the counties that are not reporting, all the Department of Public Health has to do is send out a directive, report. Mike, you have something to say?
Yeah, I was just going to add that one of the things that's most important that's missing is information about deaths that are occurring in nursing homes. The state has hidden all of that information, and none of the information that disclosed on Friday addresses the residents who are dying in these facilities. It's shocking how many residents in nursing homes have died across the country over the last weeks. We deserve to know where they're dying in California and try to do something to stop it.
Well, thank you very much for answering that, folks. My other question is more broad. It's more, and I've talked with a couple of you about this, but I was just hoping, since I have you all here, the idea of COVID-19 could become a wake-up call to try to reform nursing homes in some way, and elder care just in general. The idea that we're parking people in places and in institutions basically over the long haul. If there's one thing, maybe a couple of you don't all need to chime in, but maybe a couple of you could, and it's just kind of, what would you like to see come from this, come from COVID-19 about the way we handle elder care in general and kind of warehousing, old folks in places, in these institutions? That's all I got.
Tony and Mike, why don't you get in there? Because I know we've talked about this. We have a lot of ideas on that. So I'll turn it over to Tony and Mike Dark and Mike Connors. Go ahead.
Yeah, thanks, Pat. This is, in terms of like a narrow focus from COVID-19, we hope that the federal and state government law enforcement agencies take infection control much more seriously than they had before, and understaffing as well. We know from CMS's own figures that roughly 388,000 long-term care residents die every year from an acquired infection in a long-term care facility. That's a staggering number that should have set off alarm bells a long time ago. And it's sad that it took COVID-19 for it to happen, but hopefully we'll take infection control much more seriously. But in the bigger picture, I think that you're absolutely right. This should cause some reflection on how we do long-term care in this country generally. Putting people in large facilities, or in some cases warehousing them in large facilities where there's not a lot of connection to the outside world is just the wrong model. So I hope that this builds on the momentum that we already have in this state towards home and community-based services, an approach that's much more personalized for long-term care recipients.
And in the end, it is all about the money. I think what the virus has done is really put a spotlight on what's been an ugly underbelly, a truth about the healthcare system for decades. And that is that long-term care facilities in particular are trying to squeeze a profit out of state and federal health subsidies that are so small that the only way they can be a profitable enterprise is by cutting basic care, cutting things like staffing. And it's those practices that gave rise to the infection control issues, the neglect that long predated the virus and has come so horribly to light with this epidemic.
I think it's also important to understand that that what's happening in the nursing homes is not just impacting long-term residents. Okay, my father was not a long-term resident in the nursing home. My father was there purely for physical rehab. Okay, and it impacted him. And I saw a woman interviewed whose husband was there for physical rehab of his arm, and he passed away in early March, also in Gateway. And they just said one day he was unresponsive, and she suspects that he probably was a undiagnosed case of coronavirus. And I think it's important to understand that just because people have been diagnosed with the coronavirus does not mean that that's only where our focus should be. I think there are other residents that may have passed away in March, in February, that may have also been affected with the coronavirus, and no one spoke for them, and no one was able to dig this up and to determine what happened here. So I think we have to make sure that just because it's a nursing home, we do not automatically assume that these are people that are living the rest of their lives there and they're staying there. That's not the case. There's a combination of a lot of different types of people in nursing homes that are impacted by this.
This is Jessica Lehman. Yeah, I agree with that. And I just want to add to that. I think you're right that this could be a really important wake-up call about the times people are warehoused. And one thing that we see, given Mr. Acrie's point, is the people who go into facilities intending to be short-term, and it turns into long-term. And those cases are particularly troubling. As a person with a disability myself, I use a wheelchair, and we do trainings on ableism and ageism. And sometimes we ask, who here wants to live in a nursing home or another facility when you get older? And you can imagine that generally not one single hand goes up. I say generally, I can't think of a time when any hands went up. And so part of it is really changing our system so that people have options. That sometimes the narrative is people only go into a facility when that's their only option. And well, what are we looking at, right? As far as home and community-based services, not only for the individual, but for the family, right? When family members are able to provide care? Do they get appropriate family medical leave? Do they get the appropriate economic support so that they can survive? Do we have a good system? We don't, right? I know from firsthand that we don't have a good system of having enough personal care attendants or caregivers to do the work, people who are paid enough that people want to do this work, that it can be sustainable, that it's not just a transitional job. That we really need to build up our entire system of how people get the short-term and the long-term services and supports that they need, so that people have real options and can be in the community and can be in a setting that is good for them and good for the community, right? We all benefit when seniors and people with disabilities are active in our community rather than being isolated in a facility.
And this came up when Los Angeles County advised people to take their relatives out of nursing homes and bring them home. And our response at the time was, yeah, that's great. That's easier said than done. Number one, many people they can't afford to care for somebody at home. If they could afford to care for somebody at home, they would. Maybe they live in a one-bedroom apartment. Secondly, there's no testing. You're going to take somebody out of a nursing home and they absolutely don't test everybody. They'll test some of the people. That's why we don't know how many people in nursing homes have the coronavirus. That's why we don't know how many people actually died from the coronavirus. We believe that the counts that they have right now are terribly undercounted. The other problem, of course, is that we do not have adequate home and community-based services for people to care for their relatives at home. So, if people could, of course they would. But there's so many things that we need to do. And yes, I agree. This is a wake-up call for everything, for infection control and prevention, for understaffing, for the way that we provide funds to nursing homes in the first place. We have to remember that over 80% of the nursing homes in this state and in this country are for-profit large corporate chains. And that's something where the bottom line is not for the benefit of the residents, it's for the benefit of the stockholders.
And change is quite a heavy lift. I mean, the proclamation is a testament to the power of the industry. When they're talking about immunity, there'll be no accountability. If law enforcement can't look in this, if there's no civil liability, then how do we make a move towards finding out what's really going on and making recommendations for the future? The power of the industry is almost inconceivable. For them to ask for a blanket immunity and the governor to give them a blanket immunity leaves not only consumers, but everybody in California vulnerable to the whims and the capricious nature of people who are involved in healthcare simply for the money.
Mike Connors, you wanted to say something?
Yeah, thanks for the question, Brian, about the wake-up call. Another major concern that needs to be considered is why we have so many bad actors running California nursing homes. It's sort of, just shameful. The same operators over and over and over again. Residents are neglected and mistreated and suffer. There's not enough staffing. There's no infection control. These problems go on and on and on through the years. And the Department of Public Health has voluminous records demonstrating how poor the care is in their facilities. Yet we have no system to weed them out, prevent them from getting in and taking over nursing homes in the first place. California can do much better. There's a lot of issues we can do much better, but one of the major ones we need to look at is who's running these facilities and why do they have the kind of power that Prescott was just talking about.
Well, it's getting to be almost 12:15. If there are not any more questions, yeah.
Question. Hi.
Yeah. Oh, can we hear you? Brenda?
Yes. Hi. Quick question. These are obviously extraordinary times for healthcare workers and for many of us. Would the advocates here support any liability protection or immunity for administrative or civil actions related to COVID-19?
So this is Mike Darks. I think our concern is not that an ambulance driver is pressed into helping a COVID patient that they find on the street. That's not the kind of care that we're concerned about. We're concerned about the fact that these operators who have had a decades-long track record of infection control, staffing violations, and abuses will now, under cover of the COVID epidemic, be excused for conduct that they should still be liable for.
Yeah, and I would add that any immunity provision, we'd have to see it, but of course this is balancing. We're all trying to find the right balance to make sure that we save as many lives as possible, and if some form of immunity helps with that, then we would be willing to consider it. We think what the providers have asked the governor to do goes way too far and shifts the balance into actually harming people more than helping people.
And staff and patients are in the same boat. This is going to harm staff by making them work too hard and disincentivizing their nursing homes to supply them with protections.
Well, I mean, I think if you're talking about something like you're in the acute care hospital, you're rationing ventilators, things like that, of course not. That is not something that we're addressing here. What we're talking about are reckless and negligent behavior on the part of these facilities, and to offer a blanket immunity for all criminal, administrative, and civil actions is just not appropriate at this time.
This is Jessica. I just want to say, speaking for Senior and Disability Action, we definitely oppose immunity based on rationing care in hospitals for ventilators. We think that's a huge, huge problem. I think where this really needs to start is for facilities to say, what do they need to provide appropriate care and to prevent lawsuits, right? That they need to be worried about how are they doing the right thing, not how do they just not have to worry about someone suing them.
Yes, I agree, Jessica. Very, very well.
Any other questions?
Okay. Anything else from anybody else? Any other questions? Yes, what's your name? I'm sorry, your name's not up there. You need to put on the mic.
Unmute.
Oh yeah, unmute. Unmute.
Can you hear me now?
Yeah.
I'm sorry.
Yeah.
This is Mary Callahan. I'm with the Press Democrat newspaper. And forgive me, I joined late, so I may have missed this, but I'm wondering if the governor has given any indication or his staff has given any indication about their view on this request.
Well, so far, from what we understand, is that he's willing to sign it. And we're hoping that he will, if he does sign something like that, he'll at least amend it. Tony, do you have any late adds to this?
Our information suggested that the signing of this, that giving the providers what they asked for was imminent. But the fact that a few days had passed since we were told that gives us some hope that maybe we can influence the way this comes out.
Mm-hmm.
Thank you.
Thank you. Any other questions? You can always email us, and we post all the updates, anything that we can, on our website. We have a special COVID-19. I want to thank Mr. Acri. I want to thank Jessica, Teresa, Blanca, all of you who joined us today, and all of you, the media. And again, if you have any questions whatsoever, you can just email us at canhr.org, and we'll answer questions.
Yes.
Anything else? Then we will end this. Thank you all so very much. I appreciate it. And we really hope that the governor will listen to us and to you. Thank you.
Thank you.
Thank you, CANHR.